Welcome to It's Your Case, presented by VetCity.com. I am Manuel Pinilla, your radiologist on demand for today. Today's example is a 1-year-old female crossbreed dog presenting with lamenes of the left front limb. Once you have reviewed the radiographs using your systematic approach, then you are ready to watch this video. I will highlight the most important findings for the left shoulder in this case, and I'm going to start by taking a closer look at the humeral head in this mediolateral view. If you look very carefully, you will notice this very thin and well-defined mineral opacity, which represents the subchondral bone of the humeral head. And as you follow this caudally, you will realize that from this point onwards, the line starts to fade away, and the humeral head, instead of being rounded, is slightly flattened. So we do have a defect in the area. You will also notice a linear mineral opacity here. And if you look closely, this is very subtle, but the humeral head in this part is slightly more heterogeneous than in other areas, like for example here. So what we have here is a very nice example of osteochondritis dissecans, which is the progression of osteochondrosis. And osteochondrosis is an anomaly in the formation of the subchondral bone and cartilage, which very often in dogs will occur in this area here. Now, as the cartilage fails to form into bone, it will eventually get thicker and it will break off into fragments or flaps, which generally are made out of cartilage. And as they are made out of cartilage, there are soft tissue opacity, and generally we do not see this on radiographs. However, here we can see this flap perfectly. And the reason is that this cartilage here is undergone some degree of dystrophic calcification. As for this area here, probably we have a combination of factors, which is sclerosis adjacent to the defect, but also the defect itself and that partially mineralized flap. They surround slightly the humeral head and they are therefore superimposed on it. Now, these animals with large osteochondral defects will very often develop with time degenerative joint disease. So we need to look for some signs of arthrosis, and common areas for osteophytes to develop would be the caudal aspect of the glenoid here and also caudal to the head. I don't see anything specific on those areas. However, if you have looked at the caudocranial view, you may have noticed that there are some areas that are irregular, and we can see some osteophytes developing in some of the bone margins. So the dog has some early degenerative joint disease. Something that is very subtle, if you look, this part of the bicipital groove is slightly sclerotic. It looks slightly more opaque than we would expect. And what this is likely is some degree of osteophyte formation. Now, whenever you have degenerative joint disease in the shoulder, this is one of those areas where the osteophytes will start to develop. Now, this does not necessarily mean that there is primary disease of the biceps tendon. You will see this as a reaction to pretty much any other intra-articular disease process that are chronic. Looking carefully back to the humeral head, you may have noticed something. And if we look between the subchondral bone, which are these arrows, and the joint space, we do have a homogeneous soft tissue structure here, this band of soft tissue. Now, this is something that we normally do not expect to see on plain radiographs, and that is the actual articular cartilage. What is happening here is that a normal joint is full of fluid, or you have cartilage that contacts the opposite cartilage, so we cannot see that margin. This joint, however, is full of something that is less opaque than soft tissue. And if you go back to basics, there is only two things on radiographs that can be less opaque than soft tissues or fluid, and that is fat or gas. Now, it doesn't make any sense to have a joint full of fat, so we are pretty much left with only one option. So this joint contains gas. This is what we call vacuum phenomenon. This is not something that we've put there. What happens here is, to position the limb, we are pulling on it, and that will cause the development of some gas inside the joint space. It doesn't have any specific clinical meaning. However, we do see this more often in cases where there is osteochondral disease compared to healthy animals. Now, just make sure that you are thorough and look at the rest of the radiographs. In this case, I would pay particular attention to the metaphysis and to the diaphysis. Look that you can see the trabecular bone. And this is just to make sure, as is a young dog, that you are not missing panosteitis or any other concomitant diseases here. So to conclude, the dog has got osteochondritis dissecans with some secondary degenerative joint disease. and this will very well explain the clinical signs of the dog. My recommendation would be to go and take radiographs of the other shoulder, because the disease is very often bilateral, even if it presents as a unilateral lameness, so you may want to exclude an early stage of OCD in the other side. So be sure to review the full report associated with this case. Thanks for listening, and remember, it is your case, so please, you can post any questions or comments on the social media.